Good evening. It's my pleasure to welcome you tonight for the conclusion of our Physician Renewal Week. During this week, we've had many wonderful presenters and opportunities to connect. And as a reminder, these sessions have been recorded and are on our YouTube channel if you or your staff would like to reference them. Tonight will prove to be another valuable CME session, and I'll introduce our speaker soon. But before we move forward, I'd like to recognize our partners and session speakers this week. We are showing those organizations right now on our screen, which have been involved in the Physician Renewal Week. We thank them for their partnership with MCMS and encourage you to consider them when making a purchase decision for your practice. And I also want to recognize a very special person's birthday today, Dr. Annette Pham. Dr. Pham, thank you for your leadership, and we wish you a very healthy and happy year. And I also want to go ahead and ask you for some questions, which will relate to our CME program. So I'm going to go ahead and ask some questions, and here is the first one. What type of Zoomer are you tonight? Are you the one walking around the house, the one who just got off another call, the one with the camera on, the one who always talks, or the one multitasking? So that's your first question. You can go ahead and answer that. I'll give you another moment, and then we'll go on to the next question. Okay, the second question. Carissa, did you want me to move on to the second question?
Yeah, they should see both up on their screen, the first two,
Okay.
and then we'll do the second.
Okay, I only saw one. Okay, so the second one is, how are you sleeping? So that's a scale: 1, better than ever, or 5, sleep. What is sleep? So, 1 on a scale of 1 to 5. So you can go ahead and put in your answer. And this is nice. We have our results. So most people are the ones that just got off another call. So here we go. Typical physician doing way too many things, and 30% multitasking, also typical. I can say that I was doing that just a little bit ago too. So how are you sleeping? Better than ever? So that would be 10%. And then 2 was about 30%. And yeah, so it looks like, a third were 2, a third were 3, and a third were below 4. So that's a little bit concerning, honestly. So that's interesting to know. And when we have Dr. Song speak tonight, that will be very good to discuss these things. And then Carissa, should we put the next 2 questions up? All right, so number 3, how is your bandwidth? This is also a scale of 1 to 5. Do you have too much time on your hands lately? Or, all the way to 5, like the rabbit from Alice in the Wonderland. I'm late to everything. So that's number 2. And you can go ahead and put in your answer. And so, Chris, are you going to put up number 4 in a minute?
You should see it now.
Okay. I'm not seeing it, but I'll go ahead and read it. So number 4 is, have you ever tried and underscore for fill in the blank, sorry, for relaxation. So I want you to check all that apply to you. Do you do meditation or breathing exercises? Is yoga good for you? Journaling, drawing, painting, gardening. So please go ahead and put those in, and then we'll look at the results in just a minute. Looks like our poll is in progress. All right, so the poll results showed that how is your bandwidth? So too much time, very few, 8%. And on the other extreme, too little time, 8%. So most people are somewhat in the middle, mostly 3 and 4. Very interesting. So third and third. Number 2, have you ever tried for relaxation? So many people do meditation breathing exercises. That's very good. 50% do yoga. I can say that I'm one of them. Journaling, drawing, and painting. Okay, very good. 17%, 8%, and gardening for 25%. So a quarter of the people are gardening. Wonderful. So let's go ahead and head into our CME program. And with that, I'm going to be introducing Dr. Suzan Song. So the purpose of this session really is, the goal of Physician Renewal Week is to help all of us be the best we can coming out of COVID. And so it is my pleasure to introduce our CME speaker, who will introduce self-care strategies that we can implement to aid in our well-being. Following tonight's presentation, to claim your CME, please complete the CME evaluation, which you'll receive via email. And it's going to be placed in the chat section also. So we welcome Dr. Suzan Song, MPH, PhD. She's a Harvard and Stanford trained humanitarian psychiatrist. As both a pediatric and adult psychiatrist and humanitarian protection advisor, she studies and builds social and emotional resilience in children and adults. Translating emerging findings from neuroscience and attachment research from all around the world into real life experiences and advocacy, Dr. Song helps people build internal peace in their lives. She's the director of the Division of Children and Adolescent and Family Psychiatry at George Washington University. She's the advisor to the U.S. State Department on Human Trafficking and a humanitarian protection consultant. Tonight, she will help us recognize the physical and emotional signs of stress, establish dialogue regarding issues surrounding personal and professional values, meaning and purpose, and explain the central tenets of demoralization, burnout, and clinical depression. She will articulate key ethical issues in practice that can lead to moral injury, assess your own self-care practices, and create your own care plans, and determine effective ways to overcome barriers to implement self-care. Dr. Song, we welcome you and thank you for being with us tonight.
Wonderful. Thank you so much for having me. I see some familiar faces, so I'm really excited and happy that you're all here. If you feel like it, of course, feel free to put your video on. We have an hour, and it's a fairly small group, which is nice. So I would love for this to be interactive, and I really want this to be useful for you, right? Many people have Zoom fatigue right now, of course, and also as physicians, part of the training of medical school is we learn to put others' needs before ours. And so we miss the birthdays, we miss out on our kids' events or the funerals or the parties, all because we have to take care of people. That is noble, and it's of course necessary at some times, but I think we internalize that a lot. And when we do that, it really interferes with our ability to attend to our own needs, to our own boundaries, and to really take care of ourselves. So for this, brief, less than an hour little workshop, I really just want to go beyond the self-care of bubble baths and to kind of get into what's really going on and what are your own innate ways of managing stress and adversity, especially during this year and a half of the pandemic, where as healthcare workers, physicians, this has been an extremely trying year, especially for physicians, where often people have felt disposable, replaceable at times, and that leads to some moral injury. So if you can feel free to please pin me so that if that's helpful at all. Some people like that. It's just seeing me as the face there, so it can kind of be an individualized session. It's also fine if you're depleted and you want to make dinner, while I'm in the background, that's fine too. But I really want you, in order to get the most out of this, I would ask that, if you are as present as possible, because we're going to get kind of into some nitty gritties with some exercises. So if you have any pen and paper, get that next to you, or your computer, have an area where you can just type for yourself. Maybe close, I know this is really tough, but close out the other screens on your computer, and maybe mute your cell phones if that's okay. The goal is very modest. Just want to give you a new perspective on thinking about your own self-care, to offer maybe 2 or 3 practical things to consider, and to help make an individualized plan that strengthens your natural way of coping, so that we're more assertive and less avoidant in our lives. If you have any questions throughout, feel free to just put it in the chat. You can also chat with me privately, and I'll try to monitor at the same time. All right, so pen and paper. If you have any fidget toys or doodling things that you want, that's fine. If I have my tea here, if you want to have your adult beverage, that's also fine. But just settle in and let's drop in to this session. So first, if you can wiggle your toes for me. Just wiggle your toes. And we say, oh, hi, toes, right? We forgot that our toes were there. It's just a reminder that we are busy, we're going on with our lives, and we're not exactly always connected to our bodies or ourselves. You can do this throughout the day. When you're feeling really stressed, you're like 5 minutes between patients, wiggle your toes, and it brings you back into where you are, into our present self. Now move your attention from your toes to now feel your legs. If you're sitting down, feel the lines where your legs meet your chair. If you're standing up, feel how heavy your legs feel. Just notice your legs. Do they feel shaky? Do they feel strong or weak? Now move on up to your stomach. How is your stomach feeling? Are you hungry? Is it grumbling? Are you full? Are you nervous or jittery? Now move up to your chest. How is your chest feeling? Is it tight? Relaxed? Do you feel like you've got open space when you take in a breath? Do you feel expansion? Move to your head. How is your head feeling? Is it heavy? Do you have a headache? Does it feel light as a balloon? So we just take a moment, that's just literally like less than 1 minute, maybe 2 minutes, to just do a quick body scan to bring you back to yourself. You are the most important person in this life, right? So focus on your body and how you're feeling to connect you first. Now we're going to connect to how you're feeling. So write down for me, either the chat or just to yourselves, just how are you feeling? And I'm going to send you in the chat, I'm going to send you a lot of people have a hard time knowing what they're feeling. So I have a list of feeling words. If you want to pull it up. If you are saying you feel exhausted, you feel angry, or you feel anxious, I'm going to push you a little bit, because those tend to be kind of the kitchen sink emotions. There is something underneath those. So what specifically are you feeling? When you say, oh, I'm just so tired, what does that mean? It might be you're physically exhausted, it might be you're emotionally exhausted. But what's underneath there? When we're saying we're irritable, what does that mean? Now there is kind of one column that's a quote more like a positive emotion, the happy, and the rest are more difficult emotions. And that's just because people seem to be fine when we have a quote happy emotion. But it's when we have this, like, we're tense, we're conflicted, we're irritable, that's when people just say, oh, I'm angry or anxious. And so I put a lot of feelings in there to flush it out. All right. So now at least you know how your body is feeling. You know what your emotional state is. Okay, so that's a good start. So I want to tell you a story about a colleague of mine. His name is Dr. Achille. He was a physician in West Africa, a surgeon. He started his morning off like normal. He had his breakfast. He kissed his wife, his 2 kids on the cheek as they went to school. He went to this hospital to work. He was the only one surgeon in a very rural clinic. And little did he know that that would be the last time he ever would see his family. So outside of the hospital, there was a very small political protest, as we've seen around here in the DC area. But the protest got out of hand, and there were some injuries because of the violence. One of the protesters ended up at Dr. Achille's hospital. Now, he is not political at all. He prided himself on healing and being a good physician. So he saves the protester's life, unaware and not caring that the protester happened to be the leader of the political opposition. Because Dr. Achille saved the life of a strong political dissident, he was kidnapped, held in isolation, he was tortured, and awaits execution. So just as his being a good physician got him in this place, it would also get him out. So one day the prison guards rotated, and the new guard, instead of beating him, he smiled when he saw Dr. Achille, because he recognized him as the doctor, the surgeon, who had saved his mother's life. He had done surgery on his mother. And so he was so thankful to Dr. Achille for saving his mother's life that he helped Dr. Achille escape, which he did. He made it to DC, where I saw him in my office. So he came to my office saying, he feels incompetent now because he can't practice medicine anymore. He knows he's a very well-trained physician. He had done 3 trainings around the world. But here he's infantilized, he's confused about his legal status, he's hopeless. He doesn't have support here, he can't see his family. And he feels like he's not coping. He's got nightmares, poor sleep. He's got fatigue and pain. And what he wants most is relief from this overwhelming burden of the world. He didn't know how to keep on living. Now, so why am I bringing up Dr. Achille? It's because I believe if you want to learn something, we learn from the most extreme cases. So if I want to learn how to snowboard, I'm going to look at Olympian Chloe Kim, who's a snowboarder, right? So Dr. Achille was feeling hopeless, confused, helpless. He bared the weight of subjective incompetence when he thought he was failing his own or other people's expectations for coping. He was overwhelmed with emotions, emotionally burnt out, all of which were valid. If any of this sounds familiar to you, you might be experiencing demoralization. Demoralization is what I have found most all physicians have experienced during this year of pandemic and political unrest. It's different from burnout or depression, right? With burnout, you can change a job and you can get rid of the burnout. Medication can help with depression, but it does nothing for demoralization. So the term was first introduced in 1961 by psychiatrist Jerome Frank. He worked with clinicians working in a drug addiction center, and he saw how overwhelmed they were. So demoralization is a persistent, subjective inability to cope in the face of overwhelming situations. It's when we are rattled by these moral injuries that our usual beliefs and convictions just give way to uncertainty, frustration, and restlessness. Our trust in humanity dissolves, leaving us feeling kind of futile. So demoralization is not a mental illness. It's a normal human response to an overwhelming situation. The normal response to everything that's been going on with the pandemic and the school closures of your parents, working remotely suddenly, the police brutality, the social unrest, the wildfires we had, the threats to our democracy, the traumatic loss that so many physicians have bared witness to, and the minimization of the loss of life. As physicians, we all know death, right? We're used to death, we're used to illness, but we aren't used to the scope and the scale and the level of the moral injury that accompanies that. It challenges our morals and our sense of security and trust in our society. When we have people who say they don't believe in a pandemic, right? They're making fun of people masking, or when when racism and violence is sanctioned in our society, right? These are going against our moral our values. So in many ways, demoralization, it's just a normal response to this huge overwhelm that we've had. And this leads to this avoidant coping. So we sleep in a little longer. We avoid going to the gym. We just stop cooking healthy foods. We stop chatting and talking to friends. Right? We put off our tasks and things that we know have to get done. So we avoid instead of assertively coping and engaging with life. We tend to languish. So here starts a cycle of worsening demoralization that goes into depression and more languishing. So there's neglecting, taking care of ourselves, unhealthy diets, erratic sleep, lack of exercise, substance abuse for some people. Our personal relationships suffer. And over time, suicide becomes an option. Right? We all know that physicians have twice the rate of suicide than the general population. And oftentimes it's to manage this profound demoralization from years of pain, frustration, confusion, uncertainty, and lack of agency. So I want to address demoralization because it's contagious, especially when the problems are realistic and they lack solutions. Now, I work with adversity across the spectrum, survivors of torture and kids currently exploited in human trafficking, families separated at border, to high-profile politicians, executives during this pandemic. And there are times when I doubt my own competence. I want to emotionally distance because these are real problems and there are no easy solutions. But these communities have shown me that hope can be a strategy to survival. Now, hope is fickle. It's really hard to solicit hope during a current crisis. And it's hard to sustain hope when these stressors are extreme and prolonged and we're tired of it. We have pandemic fatigue ourselves. We're numb from the world's traumatic events, like what's going on in India right now. We're emotionally depleted, right? We have little capacity for managing these feelings, let alone the ability to find hope. But if my survivors of torture can still have hope, we can too. So hope is something that you do. It is not something that you feel. It can be practiced. So first we make a commitment. We say, we're going to make a commitment and a deep desire to step towards having hope. We commit to saying, this is the type of person I want to be. This is how I want to act in the world. So I make a choice to actively engage and face the adversity instead of avoiding or numbing, submitting or withdrawing. The goal is to shift from avoidant to assertive coping. All right, so here's an exercise I'm going to do with you just to tap into what your naturally embraced way of coping is. So I was on the West Coast for almost a decade, and there I started yoga, I started mindfulness practice, meditation. My patients there were all over it because culturally it was embraced. I came to DC and I work with downtown with a lot of politicians and lawyers. And I just mentioned the words like mindfulness or meditation. And you could just see physically the anxiety levels rising, just even the concept of that. So what works for one person doesn't work for another. I can't tell everybody to go do yoga because for some people, the experience of yoga, especially if they've had a trauma history, can actually be re-traumatizing. So we wanted to tap into our own unique ways of coping. So I'm going to ask you to think about a past adversity. Doesn't have to be big. If you've had a major trauma, now is not the time to go in there, right? Unless you want to, but just something like an argument you had recently with someone. Maybe it was a loss that you've had, someone passed away. Maybe it's like some hard feedback that you heard. But what was an adversity that you've gone through? Then I'm going to ask you, how did this affect you? How did it make you feel? What did it take from your life? And then I'm going to ask you, how did you respond to it? So what did you do? Okay, so I'll give an example. So my adversity that always comes first to mind is that I lost my father. My father passed away when I was 15 years old. So that's my adversity. How did it affect me emotionally? I became numb. I was very withdrawn from friends. It kind of took away my fun and what I perceive as my childhood innocence. And so how did I respond? Well, I began to work a lot. So I got 3 jobs so I could help my family pay for my own college and my brother's. And I isolated myself quite a bit socially. I also made the decision to become a physician because that to me was helping, but it was also financial security and job security. Okay, so that's my example. Now it's your turn. So think and maybe write down for yourselves, what is an adversity that you've been through? Just think about it, write it down. Okay, now how did the adversity affect you? How did it make you feel? And you can refer to that list of the feeling words that I mentioned before. How did it make you feel? What was the impact? And then how did you respond? What did you do? What was the first thing you did in order to cope with it? And if the thing you did was something that was somewhat harmful, like substance abuse or yelling and arguing, then maybe think about how you would have wanted to respond. What would have felt like a healthier way for you to cope with that? All right, I'll give you a moment. And if anybody wants to unmute and share, that's fine. And if you don't, that's also fine too, because it's personal. All right, so with this is tapping into your own natural way of coping. All right, and so someone mentioned that the adversity was her husband passed away in 2014. And so what she did in response was to start journaling. And now she's been writing daily for the past 7 years. We found that extremely helpful. Great. So think about your own reactions and your responses and your natural way of coping, because they tend to fall into one of 4 categories. And these 4 categories are all ones that we can develop and practice. So the first category is problem solving and goal seeking. So when I said my response was, I decided to become a physician, and I kind of organized in my mind what it would take to do that, to get there. That is problem solving and goal seeking. So we say, I need to think about how to solve this problem and to figure out how to make this happen. This kind of executive function requires 2 different types of thinking. So a pathways thinking that envisions that desired future, right? And the different paths to get there. So it's that brainstorming part. But there's also a part that's needed, that's the agency thinking. That agency thinking has the attitudes and the self-talk to sustain a sense of self, that you can accomplish your goal, you can do it. You need both. You need the pathways thinking and the agency thinking to achieve your goal. It's the interaction of these that led what's called a shift and persist approach to life. And there are many studies that show that this approach to life of shifting and persisting, it's a very powerful factor for overall health, especially with at-risk adults in low socioeconomic settings. Right? So it's that when we are encountering adversity, we shift our thinking. We say, this is what the goal is, and we believe that we can persist to keep getting it done. Okay, so just ask yourself, like, Was your natural coping in that bucket? Problem solving, goal seeking. The second bucket is relational. So many people, after an adversity, they first want to go talk to someone about it. Right? They seek out relationships. They have that heart-to-heart conversation. It's these attachment relationships that give confidence or a sense of security. But it can also be having a mentoring relationship. It's embracing a family or team or a work group. It can also be altruistic relationships, right? Where you're giving or reciprocal support. These relational cues can activate a set of neural circuits that decrease our kind of avoidant behaviors and our stress responses. So if you are the person that says you went and called a friend, or you went to a loved one's house after your adversity, then maybe for you, relational coping is most prominent. And know that all of these, it can differ based on the scenario. So I used to work in the humanitarian sector. So I was often in post-conflict settings or in refugee camps, whatever. And I would come back and people used to ask me, like, how do you manage when you come back? These really difficult kind of war-affected areas. Did you have a peer group? And everyone asked me, like, do you have someone to talk to? Do you have a peer group? And actually, I don't want that. Like, I wanted to just come back and deal with it on my own and think it through and experience it by myself and not talk about it with anybody else. That was just my own way of coping. Whereas other people I know in the field, they have peer groups, they have these debriefing groups, and that's really important to them. So again, we want to find your own individual way, what's comfortable to you. All right, then the third kind of bucket of coping is activating a core identity. So this is asserting your belonging or worthiness in a group. This motivates assertive coping, despite some hard stuff going on. So, if many of you, let's say last year, participated in the Women's March, right? You said, there are kind of violations going on that are not okay. And so I am going to activate my core identity as a woman, and I'm going to participate in this Women's March. For some people, that core identity is about being a physician. And so we go into our identity as a physician. So think about, to which group do you belong? To which group do you feel worthy of belonging to? Right? Who are you a member? Whose group are you a member of? And this could also be your family. It could be a team at work. It could be structured by responsibilities. But it taps into this collective identity of who are your people. And it could be gender, age, ethnicity, religion, political party. Now, what's hard is when these conflict with each other. So if, for example, so my friend was very strongly identified and did a lot of activism with the LGBT community, but he was also religious, and his religion was anti-LGBT. So those two identities are in conflict. That leads to suffering. Okay, so then think about the last category, which is to strengthen emotion regulation. So if you had your adversity, let's say it was an argument with a spouse or partner, and you right afterwards said, I have to go for a run. I just need to get out there and like move my body. Then this would be your bucket. This is anything to reduce stress and regulate your emotions. It could be a spiritual practice. It could be yoga, mindfulness, right? Exercise, those types of things. So think of yourself and identify your main coping for that one adversity and see if it fits into one of those 4 buckets. And which of those buckets feel the most comfortable to you. So a little bit about resilience. There's the term resilience, I take kind of an academic approach to it. So the term is not very well defined in our academic literature. But to know that resilience is a process. So if there are any of you that are just not feeling very resilient right now, you're like, I could be doing better, but I'm languishing here. I'm just not at my optimal, my peak performance, right? That's okay. Resilience is time and context dependent. So we could feel resilient, like we could have felt resilient a year ago, but not right now, the same vice versa. And it's context dependent. So let's say yesterday, the chair of my department got angry at me, gave me some bad feedback. Right? I can be pretty, like, I would say, okay, I understand, I absorb it, I change my behaviors, I'm fine. But that same exact day, I come home and my husband says something negative about something I didn't do right. And then it's like soul crushing. I get angry, I can't let go of it. And now I'm angry for like a whole month or weeks because of that. I am the same person. It's the same time, it's the same day. It's just in one context, I was resilient, and the other context, I was not. All right, so now go through each of these 4 categories and identify one behavior that resonates with you as something that you want to work on. So I'm going to put it in the chat just so you have it. So 1 is problem solving. 2 is relational coping. 3 is activating a core identity. And 4 is strengthening emotion regulation. Okay, so look at those 4 and just make like one thing per category of what you would like to do. So is there, when you do problem solving, is there one thing that you want to do? Yeah, Carolyn.
You know, I wanted to just say that, you know, if the event is huge, like losing your father, I also lost my father when I was 15. That kind of a grief thing where that's something that you carry forever. It's not like a one-time argument with your husband. And I think that you cope with it I think you cope with it, it evolves how you cope with it. So in the moment at age 15, I went to my friend's house and I also was avoidant. And now I think a lot about it and have a completely different perspective. I mean, I don't, it used to be almost the core thing in my life that it was the thing that I felt defined me the most was losing my dad. And it still is very important, but there's a lot of other things that are important too. Anyway, I just wanted to say that, you know, at different times, I feel like I went back and coped with it different ways.
Yes, and it's such a great point. So part of the exercise is really to solicit what your initial, that like gut reflexive reaction is to coping. But you're extremely right that with these adversities that go on and grief, this is what grief does. It breaks part of us and we never fully get the closure or quote heal, whatever that even means, right? We change, it transforms how we relate to the world. And it is a messy process because there are times where we're fine and then times where it's just suddenly things will come up. And that is, you know, one thing I've learned with working with a humanitarian space is after a war ends, after trauma ends, it tends to be the 1 or the 2 or 3 years after that the grief starts to settle in. Because after that loss, after the collective trauma that we experience, I mean, we're still in survival mode, right? We're still trying to like figure out, you know, how to do our daily lives and take care of our families. But it's really when it's like a year or a few years out that we look back and we will see all that we have lost. And that's hard. You know, I will give another example. So there's a very dear friend of mine from medical school, Brian Fletcher, who was a lovely unicorn of a person. He was just funny and witty and brilliant and just a sweet soul who ended his life a month ago. He's an ER physician in California. And, you know, as with all grief, we can't just stop our lives and we don't want to. So oftentimes we just kind of rattle through and see, but then it's small things will trigger. And that's okay. And grief, there are a lot of myths about grief and loss. And one of them is you have to sit there and process it. right in the moment. And that's just not, you don't have to. You don't have to. It will come in your own time, in your own space. And I do think after the pandemic ends, whatever that actually means, that's when I think we're going to start to feel a lot more of the loss. So, which is why I'm really glad to see so many of you interested in thinking about how to take care of yourself during all this. Okay, so we identify one thing that, per bucket that you would like, that just resonates with you, so that the next time you go through something like just have a full day, or you got annoyed with somebody, or you spat with a family member, right? Just to like go to your list and say, okay, here are 1 or 4 things I could do, and just to help with a guide. Okay, oftentimes we know what we have to do. We know we need good sleep. We know what healthy eating looks like. We know we need exercise every day. We know all these things, but something is getting in the way. We just can't quite get the motivation to do so. So let's right now try to overcome some distractions. And let's start to get really focused on what it is that you want to do. Now is the time. We are having, I feel like, a moral reckoning right now, where this pandemic has shown a lot of the ugly sides of our society, right? Especially with the inequalities, the racial, social inequalities, earlier on, physicians and healthcare workers and teachers were disposable. Like, I think there's the ugly underbelly of our society has shown. And I think many people right now were like looking forward to, of course, people are vaccinated now, and we're looking forward to kind of getting back with life. But I do think that many people are also asking, like, how do I want to spend my time? Like, who am I? If you have lived through the pandemic, if you were lucky to not be one of the 500,000 people who have died during this, then how do you want to live your life? And when death has become part of our life because our patients have died, or because our family members and our friends we've lost, how do you want to live your life? So think about and write down. The first thing that comes to mind when I ask you, if you knew that you could not fail, what would you want to be doing right now in your work? If you knew you could not fail, what would you want to be doing with your work? And does anyone have examples? Like, feel free to unmute if you want. I kind of am very interested in hearing about what your dreams are. Okay, so write down the first thing. What kind of goals or dreams you have for your work or your life? It's fine too. And then put some time in your calendar. Schedule some time for you to do the thing you want to be doing. If it was strictly work, you would recreate the EMR to actually be useful. Yes. Yes. And you would make so much money if you did that. Yes. So the goal of this is really to think about where you want to be. How do you want to be using your time? We always come up with lots of excuses as to why we can't do this or that, but you can. You can. And I think many people right now, especially in this era of pandemic, are just thinking about, like, what do I want to do with my life, right? What's important to me? What are my values, my principles? How do I embody those right now? So think about that, and then schedule out the time in your calendar. Just as you schedule out time for your exercise, which everyone I hope should be doing, there are a few things I hope everyone is doing. The first thing is, if you're working from home, you got to have a private space just for home, and a private space for work, and a space where you're not working, right? That's like just physical boundaries. And if you're working at home, to make sure that you that others in the household know that you're working. So when you're working, you're only thinking about work and not family or other stuff. And when you're with family, only think about family and not the other stuff. And when you make the transition, make it intentional. So spend at least 5 minutes between when you shut down your computer, when you stop seeing patients or whatever work you're doing. Take 5 minutes out, do a body scan, listen to some fun music, go on a walk around the neighborhood. But do a phase shift during that transition. Too often people just kind of ease into work and then home life and work, and we need some kind of boundaries there, emotional, physical, right? So we have to make some boundaries there. And so just as you schedule in, hopefully you're scheduling in some exercise time, people that had commutes, I'm seeing now everyone's filling up that commute time with more work. Fill up that commute time with you time. So if you like to read, if you like to do your exercise, whatever it is. Yeah, pet your dogs between patients. That's fantastic. I saw a study somewhere a long time ago that said women with dogs have longer life expectancies, which I totally believe that to be true. So schedule in time in your calendar where you do your strategy time, where you think about not just like the tasks to do or what you want, like the little, like your bills or whatever, but schedule in time 1 hour per week where you think about, who do I want to be? Right? Like, what do I want to do with my life? These are the big questions, right? These are the questions that have meaning. Do a survey of your life, of how you spend your time right now. Is this the way I want to be spending my time? If not, let's figure it out. So you block aside that strategy hour once per week. And we want to start thinking about, look at your calendar, think for yourself about the things that you're doing that are taking up a lot of time in your life. And they're just distracting you. So it might be like, I have never used online grocery shopping before the pandemic. And now it's like wonderful. I do feel bad for the grocery clerks, of course, everyone who's stocking and preparing to deliver my groceries. But for me, that is such a time sink. It was like stressful for me to have to go to the grocery store. Cross that out. It's a distraction. Right? Cross out any little things that you feel are not adding value to your life. Get rid of those so you can spend more of your time doing things you want to be doing, that make you feel fulfilled, that give you meaning. Okay, so then write all that down because we're going to forget in like 5 minutes. So I feel like typically when I do these workshops, once we close out, people like forget what we're talking about, right? So I want this to be useful to you. So write down right now anything, just brain dump, anything that you might have found helpful or useful, or ways that you can cope, or things that you learned about yourself, or one takeaway, a behavior that you want to take away from this, of what you want to do. Anything that's inspiring you. All right. So I'm going to open it up for questions and thoughts. I know we've got 10 minutes or so left, but I would love to hear just how things are going, if this brought up anything for you, your takeaways.
One thing that, it was so interesting to hear you speak, because sometimes I think that we just don't even think about what more can we do with our lives, because once you get to be a certain age and a certain time in your practice, you feel like you've accomplished pretty much what you want to have done. but listening to you, I was thinking to myself, gosh, there is more, to do. And the question is, what is it? And that I think is a very difficult thing to think about. And it's interesting that you bring this up, because it does allow at least me to say, you know what, maybe there is more that I should be doing. Maybe there is more that I enjoy doing. Maybe like those little art projects that I do, maybe I should actually spend some time on those rather than kind of have them half done on the side, something like that. So I enjoyed thinking about that. And all the buckets and all those, I mean, in some ways, those are very useful. And I see how different people in my life deal with adversity in a very different way than I do. Like, especially the person you know the best would be your spouse, where, you see your spouse dealing with something in a completely different way than you would, so it's very interesting that, with those buckets, I was seeing people fitting into those buckets in how they deal with things. So that was very interesting.
Yeah, and your first point is a great one, because I really like working with physicians, because I don't know if it's the personality that goes into medicine or if it's the training that spits us out, but there is something about physicians are just overly competent sometimes, I feel, and because we can take on more, we do. And so we just take on more and we take on more and we just do more and do more until we get to this point where we feel like we've made it, we've done enough. And then we're left with like, what else can we do? Like, is there anything more to do? I feel like I've done a lot. And there is more to do, but in the way that it's finding meaningful, fun areas of our life, right? That fun, I mean, anyone who's been through medical school, I feel like you have to be a unidimensional person during your time in medical school. It's like drinking from a fire hose, the amount of information there. And I work with a lot of medical students right now who feel this, that they've like lost their personalities. And I always, whenever I work with students, I remind them, you will come back, right? Like your personality, it will come back. It's just on pause right now, but at some point you'll be able to. And the ones that do, I think there are a lot of them, that medical school mentality, we're just stuck in this routine and just do and do more and more and more. They burn out. And burnout, the term, there used to be the metaphor of burnout being like the battery that runs out of charge. And I see it much more like, I think of like parental burnout. Like if I'm burned, I have got two kids. I have a 4-year-old and a 5-year-old that are both home from school all year, and I work full time. So when I'm burnt out from parenting, I can't, like if a toy is burnt out, it just stops working. If I'm burnt out from parenting, I can't just stop parenting, right? Like burnout is more like a bank account. So when you overdraw, they charge you extra fines, and that spins you more into this downward spiral. I feel like that's what burnout is. It's like they're constantly going on all of your reserves to spin us down to more kind of despair. So anyways, so I bring that up just to comment on how we need to be thoughtful throughout our careers about the moments in which we're doing too much. All right.
I think that there is a question. Dr. Huang was saying, could you please repeat what you said about number 4 coping mechanisms, strengthening emotion regulation? Is this where behaviors such as exercise, meditation come in?
Exactly. That's right. So emotional regulation is really the things we do to mitigate our stress response system. So just to calm us down. So people really like the deep breathing. So when people are anxious and we're feeling the heart palpitations and the sweaty palms and we're just feeling jittery and nervous, people always say, okay, like take some deep breaths, right? We love the deep breaths. Therapists all love these deep breaths. And it's really the exhale. So I love a good inhale, but it's really the exhale that really physiologically calms us down. So things like that just calm down your body, but also get you into the awareness of your emotions and being able to manage your emotions, like the meditation or mindfulness. Those are the emotion regulations. Yeah, exercise. And I see the hamster on a wheel. Yeah, full day in office, then finish notes and do it again. That's right. If we don't finish everything in one day, it's going to build up and we'll never get it done. There's little room for anything else until the weekend. So this is the overcompetent. I do feel like we are trained because we can take on more. We do take on more and you do get it done. And I assure you, I actually know Dr. Gross and she's a fantastic physician, right? And so we do this. We keep upping our competency, our capacity to do more. And we feel like it's just we never get a break. We will not get a break. The system will not allow us a break, right? We cannot rely on this system or our patients or anything external to give us a break. We have to say, all right, this is my boundary. And the boundaries, oftentimes people, I feel like we know what our needs are. So we know we need more time. We need, like, let's say an extra 2 hours during the day just for us. We know we need that. We're tired. We've worked really hard. We deserve it. And yet we don't own it. When we can own our needs and be unapologetic about it, we say, you know what? I need 2 hours a day to do whatever I want to do. To do my journaling, my meditation, my yoga, whatever it is. I need that time for me. And we are unapologetic about it. Then that's when we allow things to happen. That's when we allow ourselves to put boundaries there, right? But we can't wait for our patients or the system to make our boundaries for us. And that's the hard part. But it starts with actually understanding and owning and not negatively judging. So many people, and I want to say especially physicians, because this is what we're trained in medical school. We're trained to put the patients first, right? I mean, think about call, even that like whole concept of call. You're putting aside your own need to sleep for your patients. Right? That is baked into, it's like implicit within our lives. There's so much of that implicit that we're living, and we want to make that more explicit now. Yes, 2 extra hours come at the expense of sleep, right? Mentoring some college kids, applying to med school, the process has become less and less humane. How can we change this? Entry into the profession, more supportive. It's a good question. And the question, I think it's speaking to the entry into medical school. So not medical school itself, because I think there has been a movement now in medical education to really focus on med student kind of well-being. But the entry into, it's a good point. The entry into medical school, it is rough, right? It is really competitive. And I'm sure it always has been, but you're right. I've seen these college kids and the amounts of perfection that they have to accomplish to be able to get into a medical school. I honestly think that we just need more residency, more medical school spots. I think we should be training more physicians. I also don't know if all physicians' specialties need to be as long as they are. I think as a psychiatrist, 4 years of medical school, 4 years of residency, then 2 years of pediatric fellowship. I don't know if all of that was exactly needed. And we're seeing now, with our allied professionals kind of coming into, and I won't even get into all of that, but I think we do really need to think about how can we increase and bolster the spots so that more people can get into medical school, so it's not as cutthroat competitive. Yeah. Okay.
There's one comment. Any words regarding finding balance between having a high expectation of oneself, self-criticism, or working to achieve what one knows is their full potential through obstacles versus self-appreciation?
Yeah, I love this question. I feel like, and I'm actually starting to write a book around some of this. So I've been thinking about this a little bit. When we think about ourselves and who we are, often what we call like our true self is at odds with each other. So there's this part of ourself that we're ambitious, we want financial security, we want significance, we want appreciation, we want achievement and recognition, right? All of that. That's what our society has, it's part of our social values if we live in America. And then there's this other part of us that's around service and humility and grace and collectivism and doing more for the greater good and not our individual values. And just kind of self-appreciation, right? Just kind of the ease in which we live our lives, where we say it's okay, there's more self-compassion. Whereas the first type of identity is more like, you have to do more, you can do better, achieve more because you can, right? Fulfill that potential. And the other part of us is saying, we're good, just focus on being, not doing, right? And these two are at odds with themselves. I mean, the values are actually in competition with each other. But that is our moral self. That is that integration of both of those. We can be both and. And the more that we agree and accept both of those parts of ourselves, we don't negatively judge either of those. But we first say, I'm going to get rid of any negative judgment. It's okay if I want to have my potential fulfilled. It's okay if I want significance recognition. And also, it's okay if I want to be kind of a kind human, a more compassionate human that's more around service, because you can fill both. You can. Our lives are complex. We do a lot of things with our lives. And so it might be that in one area of your life, you're one way, and that you have another activity that you do or another relationship in which you engage in a different way. But you allow both to occur. So it's an and. It's because that conflict is paralyzing for many people. We end up saying, I don't know what to do. I don't know. I have no direction. I don't know where to go with that. And I would say, integrate and say that it's okay to have both and that's the first step. And then see where you go, see what you want to do, what you're motivated to do. And we do that. Okay, so I see we're at time. I'm happy to stay on longer if anyone has any thoughts or questions.
If there are no more questions, I think we'll go ahead and close for the evening. But before we close tonight, I thank Dr. Song for a very powerful presentation. And I want to thank you all for participating in Physician Renewal Week. And I think this was the perfect ending to this week, a true culmination of everything that we're going to need to kind of come out of COVID better and stronger, hopefully. I hope your participation has been helpful to your overall well-being. We welcome your feedback about what more MCMS can do to help you to be the best that you can be coming out of COVID. So as a reminder, if you or a colleague are suffering from burnout or finding it difficult to balance in your personal and professional life, we encourage you to reach out to our foundation, which offers a free counseling program, which is confidential without insurance being filed. Counseling is provided by social workers and PhD psychologists, and you can find more information at dedicated2health.org. And so with that, I want to thank you again for joining us tonight. We wish you a very good evening and have a really great summer. Thank you.